To start your office visit, select the correct encounter, select your template icon, select the Intake SBC, select OK. Your Pill tab is going to load per provider located at the top toolbar and by your specialty and office visit. This will now fill in each of the tabs. Again, the pill bar changes per provider and by specialty. So at the intake, we have our specialty. Our visit type is office visit with Dr. Stanish. Here we're going to select whether or not it is an established patient or a new patient. Then we will select reason for visit. So I'm going to select back pain for this example. I can make any nurse comments, which is now called intake comments. So select the intake comments and add comments if needed. Save and close. I can also add or update any diagnostics that the patient may have had prior to this visit if the diagnostics were not ordered in the EHR. Go ahead and select the diagnostics, select the study type, and I'm going to go ahead and put MRI for body. Select the type of study. In this case, we're going to just do MRI lower extremity. And the study date. And then I'm going to go ahead and select C-scan report if the report has already been forward scanned into the patient's chart. If not, I can go ahead and make a comment. In this case, I'm going to select C-scan report. I'm going to also select add this to the HPI, so this way this diagnostic study will get added to the provider's HPI. This is also per department, per protocol as to whether or not you will select this. In this case, I'm going to add it to the HPI. And then I'm going to go ahead and select add to grid. So now this puts my diagnostic study into the diagnostic history grid. And then I'm going to save and close. Okay, so now it's going to show that the studies reviewed was the MRI. It's going to show in the HPI. Then I'm going to come down to my vital signs and I'm going to add my vitals for today's visit. I'm going to select add. By default, it has a carry forward height date in here. I'm going to add my weight, temperature, and so forth. If I select calculate, this will also calculate my BMI and my BSA. Save, close. And just to remind you, to get to the vital signs, you need to hit the add button. You cannot double click in the grid. Then we're going to move on to the medications, and we can do a medications reviewed, or depending on the department and the situation, we can also do our medication reconcile. So to do our medication reconcile in this example, I'm going to select the medication reconcile button. I'm going to place a check mark in the verified mode, and I'm going to select each one of my medications. I can also add a comment, so depending on the type of medication or by provider, if there are particular information that provider would like for you to gather from the patient, then you can click on the medication and add a comment. There is a pick list. You can select from the pick list, or you can free text. In this case, I'm just going to put they're taking it as needed. And then I'm going to select save. You would continue this all the way through till each one of these medications had been verified and added into the medication reconciled. If I needed to verify a medication, I would select the undo button, select the medication, and it will remove it out of the medication reconcile and add it back into the medication module window. So there may be certain medications that you may want to verify in certain situations. Maybe the provider only wants the medication that they prescribed for the patient to be reconciled, and then they want you to get additional information as to how are they taking the medication and if they are taking the medication consistently as prescribed. Once I'm done, I'm going to go ahead and hit save and close. And when I hit the reconcile button, it automatically places a check mark in the medication reviewed checkbox. Then I will go on to my allergies. If I need to add an allergy, I'm going to select the add, and it will pull up my most common allergies. I will select one from this example. I'll select penicillin, and I'm going to select hives as the reaction. Save and close. And now my medication has been added into my allergies, and I will put allergies added today. If I had not added an allergy, I would select reviewed no changes or no allergies. So that is all that we'll go over for part 1. We will continue nurse intake in the other 2 segments.